So I know mental health is a topic that I love talking about. However, I see that as aspiring mental health professionals, our mental health is something that we don't take care of on a regular basis. Would you agree, yes or no?
Yes, ma'am.
So my goal today would be, while everything sounds very fancy, how is it that we can take care of our mental health? Because till we don't take care of ourselves, we can never ever talk about anything convincingly. You've all heard the term that the therapist is a little psycho in the head. Have you all heard, yes or no? So the real reason for that is because we neglect to take care of ourselves. So since all of you here, most of you from what ma'am told me are psychology students, and some of you of course are interested in the human mind, which I think is good enough to start off. And I'm going to talk about some practical tips. I am going to have us read from my book also, which is there. So if later on when you all are budding practitioners, you can actually use it as a resource tool. How to get people to identify certain patterns that they don't talk about. Now, think of some situation in your life where you felt that it was very, very tough for you. Take a minute, and if you all are open, we'll talk about it. But think of one situation in your life where you felt that, things are absolutely impossible to manage, and, everything will go haywire. Thought of something? But later on you realize that while it was really horrible at that time, the fact that you're sitting here in front of me today means somewhere you're alive and you came out of it, unscathed. Perhaps a little bruised here and there, but more or less you managed. Would you agree, yes or no?
Yes, ma'am.
So for me, when we talk of therapy, the reason why people struggle is because they feel that difficult situations should not happen. Now in COVID, all of you who are here, everybody's like, we should not have anxiety. I don't know if you were so hard on yourself, but most of the time, so we get anxious about anxiety. Yes or no?
Yes.
Now here, till you don't understand that anxiety is normal, anxiety disorder is not normal. What's going to happen is you're going to be a therapist who's preaching, but is actually not following anything. And that's the reason why there are so many therapist jokes, because most of us feel we have pearls of wisdom to impart another, but we need not do anything. My life is absolutely sorted, my relationships are very good, I know what's happening, I can see your teachers also grinning, and I can see some of you also grinning. Because when we do that, what we do is we stop living, we start existing. We kind of, that pitfall that we want to save others from, we actually follow into it. And today my endeavor would be, as we talk, and ma'am will take the books around, is for you to understand that till you do not acknowledge that yes, feelings hurt, they are messy, they are dirty. And sometimes yes, you also go psycho in certain situations, for want of a better word. But how does it matter? What really is important is, what are you doing in the current state? And my approach, especially after COVID, was like everybody suddenly thought it was fashionable to have a therapist. That people were calling locally, nationally, internationally, because suddenly it was like, yeah, I have a mental health problem. I remember my daughter, who was preparing for college like you girls, she's like, Mom, I'm so anxious, how will I study? I said, you're not a sociopath, of course you will be anxious. You have 4 grandparents who are on the other side of 70, and anyone could cop it with all the news which comes. You have your board exams to give, and every day they are shifting boards. They're saying it will happen, it will not happen. You have colleges to apply to. So why wouldn't you be anxious? She said, that's a very weird thing for someone who's a psychologist to say. Really, Mom? You're supposed to tell me that, no, it's okay, don't be anxious. She said, here I'm getting anxious about my anxiety, and what a stupid thing you're telling me. I said, no, think about it very objectively. If I was 18 and where I thought I would be having fun with my friends and getting ready, I will not be going for my last farewell to the school, I'm not hanging around with my friends. So, anxiety is normal, but it need not be a disorder. But we need to make that space where functioning will get impacted. Where you probably would have done a little better, now you can't do it because your resources are getting compromised. And that's the reason why I wanted all of you to think about it. Don't be harsh on yourself. Because what we bring to the table is just ourselves as a blank canvas. And we can't do that till honest about what is pinching, what's really not working well right now. And when things are not working well, that means somewhere I need to be kind to myself. And we forget that. Would you all agree, yes or no?
Yes, ma'am.
Because we are so busy, and while psychology is a fun subject to study, there's so much to learn, theoretically. And some of you who are studying abnormal, this is a master's class, right, ma'am?
So they're masters, BA.
Yeah, so some of you will be, I think, specializing with clinical psychology. Some would be doing counseling, some would be doing industrial, and especially with abnormal psychology. I don't know if it happens with you all. When I was reading the DSM, I thought I had all the symptoms. I could diagnose myself with everything that is there. So what we need to realize that in our quest to become somebody, we stop enjoying the moment. We stop thinking about what is it that I'm celebrating at this point and what is really pinching at this point. And for me, good mental health is essentially just these two realizations on a daily basis. Okay, this is going really well, and this really sucks, for want of a better word. And this is something which is very blah. So if I can get into that mode, I think the best part of training to be a psychologist is you get that tool to explore your own mind. But for me, for that tool to really work, you need to be very kind to yourself. And sometimes it's about facing your own demons, sometimes also understanding that certain things just don't work in you. But do I want to play the blame game? That is something I want you all to really think about. So while of course we will talk a little bit in more detail about the book, and I'll show you some of the concepts that you read about, like all of you have heard of Carl Rogers, I'm assuming here. Everybody's heard?
Yes, ma'am.
Yeah. So when he talks about being the person that you can be, when I read that book, for me it was very, very transformational. But I said, how does one become that? Have you all read that book? His book. I recommend all of you read it. I'm sure, ma'am, you have it in the library or it is there. On becoming a person. I urge you all to read that book. It will transform the way you look at psychology. Because he talks about his experiences and how people just want to be heard. So I want everybody to take a minute and think about it. Every day, the whole competition is just with yourself, not with anybody else. And sometimes it's just about allowing yourself to even deteriorate. Most of us are very hard on ourselves when things don't work for us. We feel, I ought to do the best, I need to do that. Now, if you don't learn that basic kindness to yourself now, when you are sitting across the table with someone, you will come across as very condescending. You'll come across as someone who shows that, oh, I know it all, I can fix you up. And trust me, no one likes that feeling. The thing is, whenever I begin therapy, I actually say a one-line prayer, that thank you for trusting me enough, or giving me an opportunity to be a change agent in your life. So you need to begin from that spot of humility. Now you may say, why is it important? Because people can sense things. While you're studying psychology, I've studied psychology, everyone is. But when we have that element of condescension in us, nobody wants to listen to us. Yes or no?
Yes, ma'am.
So take a minute, celebrate life. I want you all to really think about, what is it that you really like? What is it that bothers you? What is it that you are celebrating? And when are you condescending to someone? Because you need to catch these maggots in your head, We all are condescending. Whether we agree or not, we all are judgmental. Whether we agree or not, we all are obnoxious and we all are manipulative. The reason why I use these terms is because these are going to be your constant struggles on a daily basis. And it's very easy to point out who is being manipulative with you. But to acknowledge manipulation in ourselves, how I can be a liar, is very, very difficult. So, till you all don't do that, you all will understand that you're not living life completely. Because we have these sides inside us. Some are good, some are bad, some are downright obnoxious, and some of it is just very boring, It doesn't make sense. So we all like that battle inside ourselves, the real me versus the ideal me, which goes on and on and on and on. The only way to transcend that is acknowledge all sides. Like my personal struggle was the word manipulation, I used to hate it. And I always had it that I hate manipulative people. So every time I would try to look inwards, where am I manipulative? I was like, nah, I'm not manipulative. I talk so much of truth. So it was a very difficult struggle. But till I did not identify, it took me a few years where I was specifically being manipulative. I think I would keep getting bothered by manipulative people. Once I could identify it in myself, maybe the degree was lesser or sometimes even more, I didn't get so impacted by manipulated people. It's like the noise. We can all hear. It's not nice. But you want to listen to me, so you're listening to me. I want to talk, so I'm talking to you. Otherwise, I'll constantly get distracted by it. Or I can let it be. Yes, it's irritating, but it's not in my hands. There is something else which is happening. It probably needs to be done. It doesn't make sense to me. It's not fair if I have to talk to you. It is happening. But this is what life is. So, in every day also we learn to give ourselves that bandwidth. Because there is some noise, I'll be slightly distracted, I'll miss out on some words. But overall, the larger picture I will get. So once we get that compassionate with ourselves and these disowned selves that that you read about as theoretical concepts, you'll be put into practice. So I'm going to get these poetry books and we are going to discuss it. Would you all be interested to talk about it?
Absolutely. Yes, ma'am.
Okay, so ma'am, we'll just get it. Yeah.